Hi, Dr. Damian Lebmoff with Dayton Surgeons Incorporated, and I'm here to talk to you about colon resections, both the open procedure and the laparoscopic procedure. By now, you and your physicians have decided to proceed with a colon resection, and I'll give you a brief overview as to the surgical approaches. The colon, to review, is the large bowel. It starts over here at the cecum, where the appendix comes off. This is the ascending colon, transverse colon, descending colon, and the sigmoid colon. Various disease processes necessitate one or more of those portions to be removed. There's two ways to perform this type of surgery. One is the open technique, or the old-fashioned technique, and the other is the laparoscopic approach, where cameras and smaller instruments are used. Unfortunately, not all colon procedures can be performed laparoscopically, so the decision as to which procedure to perform will be based on your physician's preference. Briefly, the open technique would include making a larger incision, usually centered around the belly button or the umbilicus. This takes 4 to 6 weeks to recover from. So if we can, we like to proceed with more laparoscopic approach, which involves putting a small incision usually in the belly button and making a small counter incision either this area or that area to perform the colon surgery. It's done in the same manner internally, it's just the recovery is quicker. When we talk about the colon surgery, there's typically what we see as a right colon surgery or right hemicolectomy for any kind of tumor or lesion on the right side, and that includes the appendix, a small portion of the small bowel, and the right colon, where an anastomosis is performed between these two pieces, typically with a stapling device. The other most common procedure is the sigmoid colectomy, where the sigmoid, or the S portion of the colon, is removed. This area is mobilized and allows this to swing down, and an anastomosis is made there, or stapled hookup. And this is typically for either tumors or diverticulitis. There are other colon procedures that are done for the other portion of the colon, but it's not as common. Now, during this procedure, it's done, of course, under a general anesthesia, meaning you're fully asleep for this. Then, based on the type of incision you need, the procedure will be performed, whether it's done the open technique or the laparoscopic approach. All incisions will be closed. They're typically not left open, and the patient will spend anywhere between 3 to 5 days in the hospital awaiting for the bowel function to return. Unfortunately, the laparoscopic surgery requires the same amount of hospitalization because, again, we're waiting on the bowels to return to function. The main difference on the surgical procedures is in the recovery. The laparoscopic surgery, you can get back to full go in approximately 2 to 3 weeks, whereas the open technique takes about 6 to 8 weeks. And again, unfortunately, not all patients can have the laparoscopic approach, but based on what type of surgical procedure is necessary and the reason for which it's being performed, the laparoscopic approach can be considered.